Good morning, everyone. I'm Diane Perez, and on behalf of the Florida Alcohol and Drug Abuse Association, welcome to today's webinar entitled Evidence-Based Outreach and Engagement Strategies. This webinar is being made available through a collaboration of the Florida Department of Children and Families Office of Substance Abuse and Mental Health and the Florida Alcohol and Drug Abuse Association. Please note that as an attendee, you are in listen-only mode and will only be able to view your name. If you have questions, please send them to the presenter and me, the host, by using the Q&A panel. The button to open the panel is usually located on the upper right side of the monitor. Please use the Q&A panel to send any questions you may have as you think of them. The presenter will address questions as time permits. Our audio is broadcast through the internet to your computer. If you experience poor computer audio, there are a few options to try on screen right now, and these options will be posted in the chat panel too. If you continue to experience poor audio through your computer, try rejoining the webinar and call in using the telephone I will call in option. You must be connected to the audio of this presentation and view it on screen as well to receive a certificate of attendance. The recording and materials used in today's presentation will be available on the FADA website within 10 business days. To access the recording, go to www.fada.org. Also, a PDF version of this PowerPoint presentation will be emailed to participants. FADA produces many webinars and workshops through the support of the Florida Department of Children and Families. To help participants track credits earned through attendance, we host an online community that provides a personalized digital journal where participants can maintain statements of credit for webinars and workshops taken through the Florida Alcohol and Drug Abuse Association. At the end of today's webinar, the web browser will direct everyone to an evaluation form on the FADA website. You will first need to register or sign in to your account to complete the evaluation. Information you provide FADA as part of registering remains confidential. Statements of credit will be posted within 10 business days after the evaluation closes in individual professional development journals for persons completing the evaluation and attending the full webinar. Completing the evaluation is necessary to receive CE credits or to access your statement of credit. Do note that the evaluation will close at midnight on Wednesday, May 1st. 1 to 2 continuing education credits are available for participating in today's webinar for persons licensed through the Board of Nursing, the Board of Clinical Social Work, Marriage and Family Therapy, and Mental Health Counseling, and for persons credentialed through the Florida Certification Board. If you are a licensed healthcare practitioner, be sure to include your Florida license numbers for reporting to CE Broker when you register with our site for the first time. If you are certified with the Florida Certification Board or licensed outside the state of Florida, you don't need to provide your certification number when you register with our site. Note, please, that WebEx monitors arrival and departure of attendees and provides a report upon completion of the event. We are not permitted to provide contact hours or a certificate of attendance if you do not attend the entire webinar. We are not permitted to provide partial credit. And now I would like to introduce our presenter, Christina Padilla. She is a leader with the California Consortium of Addiction Programs and Professionals, where she serves as the Director of Education overseeing CCAP's Education Department. She also is Director of the Business Development for the organization, wherein she travels throughout California and the nation bringing addiction-focused businesses together to promote the profession, increase access to services, and improve the quality of alcohol and other drug service provisions through education, business development, and investment in quality programming. Ms. Padilla led California's innovative criminal justice program, serving as the Offender Mentor Certification Program Director for 3 years, where she managed 12 in-person programs for training counselors. She worked closely with the California Department of Corrections and Rehabilitation in California prisons for the duration of the contract, bringing innovation and growth to the state's in-custody treatment programming. Ms. Padilla has a Bachelor's of Science in Criminal Justice Administration and a Master's degree in Counseling Psychology. Ms. Padilla is a marriage and family therapist intern, a licensed advanced alcohol and drug abuse counselor, and an international certified advanced alcohol and drug abuse counselor. She is also a certified gang specialist of the National Gang Crime Research Center and is on the board of directors of the National Association of Lesbian, Gay, Bisexual, Transgender, Addiction Professionals, and their allies. She sits on the Native American Training Institute Advisory Board and is on the Office of Problem Gambling Advisory Committee. She's also on the board of directors for the Women Association of Addiction Treatment Board, where she was the past chair and currently serves as the conference chair. She is a past board member of the Sacramento Chapter National Alliance on Mental Illness. Ms. Padilla is the Chief Academic Officer for the CCAP Academy at CCAP and Addiction Technology Transfer Center trainer as well. And now I'd like to welcome our presenter, Ms. Padilla. I'll turn the presentation over to you.
Good morning.
Good morning.
So I'm excited to be with all of you today. I am going to go to my next slide, which I'm trying to access right now. There we go. So good morning. I am your presenter today. I'm so happy to be here with you, and I'll be presenting on evidence-based outreach and engagement strategies. And thank you so much. It's great working with the Florida Department of Children and Families, also FADA, the Florida Alcohol and Drug Abuse Association. So I do want to thank them first and foremost. I am having difficulties getting to my next slide. So give me 1 second. All right. So some of the learning objectives that we're going to be going over today is defining best practices of recruitment and outreach strategies for specific populations that may be affected by substance abuse disorder. Also, we'll be talking about demonstrating and discussing evidence-based and successful models for each population. So we'll be going thoroughly through each one. African American, Latino, Hispanic communities, Asian American, Native Hawaiian, and Pacific Islander communities. Also, American Indian, Alaska Native communities as well. We'll also be developing community or regional-based outreach and engagement plans as well. So the training overview, we'll be talking a lot about cultural competency and what that is and the need for cultural competency and how it refers to EBP, which is the evidence-based practices. So if you hear me say EBP, I'll go ahead and say evidence-based practices, but that's what I'm referring to if that's an acronym that comes up. But I will be stating out the whole evidence-based practice words as well for those that join us late. Also, we'll be talking about importance of family. We'll have a couple case studies as well. We'll be talking about some social networks, persons without shelters, so homeless population. Also some tips of working with youth and engagement, gender-specific, criminal justice, and also family. So before we dive in, a lot of different aspects of cultural competency, or a lot of different moving parts. So before we go ahead and start, is very important of what culture is and how it affects care, because some people don't have basically the underpinnings of what culture is. They have been brought up in different backgrounds, in different countries and different cities, in a lot of different towns and different things. So first I would like to go ahead and kind of go over what culture is. So culture is the common heritage or set of beliefs, so like norms and values that a group of people share. So people who are placed either by census of category or by identifying themselves into same radical or ethnic groups are often assumed to share the same culture. However, not all members who are grouped together will share the same culture, okay? A great diversity exists within each broad category. Some identifications and individuals may identify with a given racial or ethnic culture to varying degree, while others might identify with multiple cultures, not just one, including those associated with their religion, profession, sexual orientation, region, or disability status. So culture is kind of dynamic. It changes continuously and is influenced both by people's beliefs and by the demands of the environment. So, for instance, immigrants from different parts of the world arrive in the United States with their own culture, but gradually begin to adapt and develop new hybrids, cultures, and allows them to function in the dominant culture, okay? This process, is called acculturation. So even groups that may have been in the U.S. for many generations may share beliefs and practices that maintain influence from multiple cultures. So this complexity necessitates an individual approach to understanding culture and cultural identity in the context of mental health services and substance abuse and peer services. So culture influences many aspects of care, okay, quite a lot. Starting, with whether people think care is even needed. Culture, influences the concern that people bring to the clinical setting, the language that they use expressed, with coping styles, and they adopt, Culture also affects family structure, living arrangements, degree of support that people receive in time of difficulties. Culture also influences patterns of help seeking, whether people are with primary care doctors or mental health programs or ministers, spiritual advisors, or community elders, I would say finally culture affects whether people attach a stigma to mental health problems and how much trust they place in the hands of the providers, depending on their culture as well and their upbringing. So that gives a little bit of insight about culture, if you really hadn't really grabbed a hold of just your own culture or what that actually defined as a whole. So why do we need, what is the need for cultural competency? So dynamics of culture described what guidelines and what shapes human behavior. They exist in different forms and could involve the following. So for the need for cultural competencies, there's a customized pattern of everyday life that's specific what is socially correct and proper. Also customary patterns, repetitive or typical habits and patterns of expected behavior followed within a group or a community. Unconsciously set in operations like instinctive ways of thinking. So another thing is people from non-majority cultures found, they avoided, getting care, stopped looking for care, for substance abuse. If they had managed care, they dropped out. So it was very important, to reach out to these individuals, because there was such a diversity growing around them, and a lot of them had avoided seeking substance abuse care. substance dependence, and trouble disparity resulted. Basically, many minority groups face lower access to substance abuse counseling and also peer-to-peer support. And a lot of the ethnic minority groups were African American, American Indians, Asian Americans, Hispanic Americans, Native Hawaiians. Also, other groups that were affected were like women and men, children and older adults, people from rural areas, people of different religions, people with different sexual orientations, and also with physical and development disabilities. So there is a huge need, for this. All right. So what is cultural competency? So it sums it up at the U.S. and in the U.S. Department of Health Care and Services. It's cited 2001. It says the delivery of services responsive to the cultural concern of racial and ethnic minority groups, including their languages, histories, traditions, beliefs, and values. So basically, cultural competency refers to a set of guiding principles developed to increase the ability of mental health providers, agencies, systems to meet the need of diversity communities, including racial and ethnic minorities. There's a lack of knowledge, as far as families, providers, policymakers, about the value of cultural competency, but research identifies a breakdown of different reasons why we still need it, and the field still struggles to define it. But it's very important. So like the word competency can be, somewhat, misleading because it implies basically to evaluate, evaluate a program. But, basically cultural competency is understanding the culture, and being competent and a lot of different cultures and basically different belief systems that individuals do have, and the understanding of different cultures. Groups belong to different systems. So now a little bit about how cultural competency relates to evidence-based practices. So many providers ask, how can we know if, evidence-based practices apply to a particular ethnic, radical or cultural group if the research supporting the practice, those practices was done on a very different population, because there's a lot of different populations. As I spoke about African American, Asian Americans, American Indians, there's a mix. So a lot of times people are like, well, how would we grab that data and research the supporting data on every different population? So what is the audience thought on that? So I'll go ahead and repeat that question before I answer it. I want to hear a little bit from the audience. How do we know that evidence-based practice applies to a particular ethnic, radical or cultural group if research supports those practices was done on a very different populations? So you can guess if you're not sure. Any comments? So I'm asking, what is the audience thoughts on this particular questions about evidence-based practices as it applies to cultural competency? Any takers? You can go ahead just to let you know. By knowing, I see by knowing, somebody went ahead and put, so by knowing your client and their family to start with. Yes, so Terry, thank you so much for joining the webinar. By knowing your client and their family to start with. Thank you so much. Anybody else, would you like to put your thoughts or guess how EBP, which is evidence-based practices, apply to a particular ethnic group, cultural group, racial? I'll give it a couple more minutes, maybe about 30 seconds, and then I'm going to move on. Anybody else that would like to take a stab at this? All right. So with that, you're still welcome to go ahead and put your question, your Q&A into the right side as I go through this particular answer. Thank you, Terry, and for everybody else that were putting their notes in the side. And please feel free to go ahead and write whatever you'd like with the questions. It's on the right side of your monitor. I also got something native, let's see, National Native Network practice, for example, on tobacco cessation. Okay, so there's a couple more that are coming through right now, but for the most part is basically taking in consideration of your client, the person that you're counseling, and family, to start with. So I'm imagining, in fact, getting some information, on that particular group and also about their culture. So the question that I asked the audience was, how can we know if evidence-based practices apply to a particular ethnic, racial, or cultural group if the research supporting those practices was done on a very different population? So basically, the answer to that is we will not know for sure until we try. So, but the limited research that's out there doesn't, suggest that EBP, which is evidence-based practices, perhaps with, minor modifications, work well across, cultures. As evidence-based practices represents like the highest quality of, care currently available, as it's based off evidence-based. It matters like the fairness that provides people with, but who might need them, but basically, in a nutshell, going back to knowing different insight about different cultures and different populations, it's very important, and also getting data from your client and your the individuals that you are serving is very, very important. So how cultural competency relates to evidence practice? Let me see really quick. I'm going to the next slide. Let's see. Give me 1 second here. All right, so how to put cultural competency into practice. So now that you've got what culture is, how it relates to evidence-based practices, also the need for cultural competency, understanding, create, translate, offer, ask, and incorporate, and reach. So basically, for the most of it all the goal is basically to, for all, programs to be more cultural competent. There's a lot more straightforward steps to help like agencies, administrators respond more effectively to people that they serve. There's also, they're not restricted just to evidence-based practices alone, but also, there's some guidelines that are to be met in a perspective. So basically, going and understanding the racial, ethnic, and cultural demographics of the population served is important. Also, become more familiar with one or two of the groups you most commonly encounter, and you're helping out with. Create also a cultural competency advisory committee, consisting of members of family and community organizations. Also translate your forms and brochures to all different languages. So if you do have somebody that works with you, or you can also hire an interpreter, you can have them form any kind of English or anywhere, depending on your population and demographics, into that population. So if you have a huge Hmong population or Latino population, you might want to translate that into Spanish. Also if it's Chinese into Chinese, if it's Russian, then into Russian. And get either a professional person to do that or somebody on your staff so you can translate your forms and brochures into that particular language. So also offer to match a consumer with a practitioner who has a similar background. That's also a good thing too as well for the individual to also see that not necessarily is it necessary, but it is also one of the things that is very effective is offering, for that individual to match the consumer with the practitioner who has a similar background. So, have ready access to qualified interpreters, if you do need to go ahead because of the culture's background. It's not just English. So you might need to call in an interpreter for your counseling session. It could be relating to any doctors, nurses, anything, any qualified interpreters, which some people in hospitals do have, and some counseling centers there are. But also make sure that you might want to hire some people that speak other languages besides just English to help out the population and the individual that's getting substance abuse treatment, counseling, medical attention. So also ask the individual about their cultural backgrounds and identities. So learning about them is very important, their cultural beliefs and values. Also incorporate cultural awareness into the individual's assessment and treatment. Also tap into natural networks of support, so such as an extended family if they have such, okay? Community groups that represent the individual's culture. So, get more in tap with that as well, too, in the community. Also, reach out to religious and spiritual organizations to encourage referrals or as another network of support for that individual. Offer trainings to your staff. This is very important. You need to offer trainings to your staff in cultural responsive communication or interviewing skills. One of the things is a lot of times our executives go to a lot of the trainings, and a lot of our line staff do not get the training as well, or one person from the organization actually goes out and gets training and doesn't teach everybody else. So if you are sent to a training or you are on a leadership role of a CEO or some type of high executive level, it's important that you offer training to your staff that's cultural responsible, sensitive, and responsive, so they can actually work with these individuals and understand the background because there's a lot of different values. So also understanding that some behaviors that one culture may consider to be signs of psychopathology are accepted in a different culture. So different things as far as different behaviors that in one culture might be accepted and others might not be at all. As far as culture, and so there's proper etiquette in some, and others where it's accepted, it might not be accepted in others. Also be aware that the individual from other cultures may hold different beliefs about causes and treatment of illness. So some communities don't believe in that. They believe some of them want to, help their loved one by family and friends, and not seek that substance abuse, either intervention, counseling, medical attention, and so sometimes it's a weakness to ask for help. So one of those things is to be aware of that, because there's different beliefs of maybe their mother and father that was brought up a certain way, and a different way of the treatment or the illness the individual is actually going through. So that's actually how to put cultural competency into practice, which is understanding, create, translate, offer, ask, incorporate, and reach. And these are some of the stuff that's important, you know what I mean, as far as understanding the individual and creating a plan for this person, and making sure that we understand their language as well if they struggle with it, and offer different assistance and ask them about their backgrounds and incorporate what they're saying and reach out to resources if needed. Okay? All right, we're going to go to our next slide. All right, so our next slide, it talks about how mental health authorities can help, okay? So designate somebody with a part-time or full-time responsibility for improving and monitoring cultural competency. So if you do have somebody where I know budgets can be very restrained sometimes, depending if you work for a nonprofit or for-profit, state or county government, you might want to make somebody the head of that, meaning that if they already have a particular role in the company, you might want to add this onto their job description or hire somebody specifically, designate one person or somebody. But in budgets, not always do we have that. So sometimes you might want to add this onto a job description. But you do want to designate someone with part-time or full-time responsibility for improving and monitoring cultural competency, all of the things that we just went through, and reaching out and making sure that individual, as far as their care is taken care of, and going through all the steps that we just went through. Also create a strategic plan to incorporate cultural competency into the mental health system as well too. Also establishing an advisory committee, we went over that includes representatives, and this is so important too, from all major racial, ethnic, and cultural groups you serve. So that's also important too, of grabbing people and asking them to be part of your advisory committee and hearing from the backgrounds of different cultures as well too. So a lot of mental health professionals can be a part of that. If you work with those individuals, it's very important, like I said, creating a strategic plan to incorporate cultural competency. I can't tell you how important that is. All right, so one of the things we're going to dive into is LGBTQIA population. So we're going to talk about them, this population first. So some of you might want to know what the LGBTQIA stands for. So the L stands for lesbian, G stands for gay, B is bisexual, T is transgender, and Q is for questioning and queer, and I is for intersex, and A is for allies and also asexual population. The LGBT population has many more acronyms as well too, so we also put a plus. And we'll go ahead and dive into the next slide. So outreach strategies. So we're going to talk a little bit about different outreach strategies for different populations, and also see a short video too with proper etiquette and working with some of these individuals, okay? So organizations must ensure the adoption of an inclusive and particular participatory approach to programming and interventions targeting toward LGBTQIA individuals. This helps address the complex set of social and environmental determinants associated with the health and well-being of LGBTQI individuals. This approach to community engagement is informed by principles and community-based participatory research. So one of the things I'd like to say is adopting and understanding a little bit more programming and interventions for this population. This population has had a lot of trauma, a lot of things through the years has been set forth, and a lot of discriminatory as we talk about stigma as well with this individual group. So adopting and understanding, as far as programming for them and interventions is huge. And helping address, the social and environmental deterrents is also very, very important. We're going to dive a little bit more deeper into this slide here in a minute. And so engaging the LGBTQIA communities basically includes increasing relevance of our policies and procedures to the population we serve, promoting cultural appropriateness, enhancing organizational credibility and effectiveness, increasing diversity, which is huge. We kind of talked about the mental health part of, having an advisory board, and also, you can hire individuals that might be specifically out in the population, meaning that they are openly gay or lesbian as well too, as people might see them as a mentor and look up to them. And like I had talked about, matching that individual with the consumer as well, the consumer with the professional as well too. Also mobilizing and empowering key community personnel and organizations, enlightening and collaborative ideas of getting not only your staff, but also what other things in the community would be very effective when working with the population. There's a lot of resources at the LGBT. In each city, there is a LGBT community center, and quite a few, I know, throughout Florida, throughout different states. If you're joining us from a different state, but specifically to Florida, there's different institutes and different educational components as well too, to getting more information, not only just culturally, but also on the community and engaging them as well too. It's important that, some of your literature that has appropriateness of when you first walk into either a doctor's office, your counseling center, a nurse, if that there's stuff on the wall. Is there anything with a rainbow flag or any type of any kind of anything representing, the community, any kind of articles, anybody that has been in office that is out and proud, So that's one of the things is engaging, finding resources, having a resource binder of having whether somebody's going to a NA or AA meeting, also, sober living housing, for LGBT individuals. And don't get me wrong, sometimes when these individuals do, graduate treatment or they are being counseled and you're doing outpatient treatment as well too, IOP or any of that stuff, not always necessary do they want to go something specific to an LGBT treatment or LGBT group or anything like that. They might just want to just go to a group or get help from a person. So it didn't necessarily need to be somebody that was actually in the community, such as an open gay person, because anybody could actually help this individual. However, they would need to be competent in helping and engaging this person to come to treatment or helping them with their medical care, as we'll see later in a video, some more proper etiquette when working. So one of the things is, another thing is besides just engaging them, but the outreach and promotional materials is important too. So must involve and engage the LGBTQIA individuals in the development of all LGBTQI related materials. So you might have somebody on your team, that works with you, or it could be even individuals that you're working with that, would say, hey, how can we make this a little bit more welcoming for other LGBT people that end up coming to our treatment facility or our medical hospital or our outpatient, and developing that. Also ensuring that LGBTQIA individual of color, various body types and ages are represented in proportions that reflect the community's demographics. So you don't have on your walls a whole bunch of men, that are barely, just have a shirt on and it looks like a party type. That you also have people that are plus size, that are various different shapes, all different colors, walking into your office or, maybe it's a community room, but you have different people with different nationalities, representing as well too, and different that reflect the community's demographics. So this language is specifically identifies LGBTQI individuals as people the program is attempting to reach. So I think we just went over that. I think like if you're in a really dominant of a specific nationality or some type of, if somebody, whether it be a Russian community, if they speak Russian, you want to make sure that you're translating all of your brochures into Russian, and also learning the culture as well too, that you want to attempt to reach, and also hire somebody as well, whether it be an outreach coordinator too as well, that attends different functions as well too, that might be specific to that community. So you can go ahead and reach out to them and see what some of their trials and tribulations are. And also somebody that speaks the language, you know what I mean, is important too. So includes also pieces written by and about recovering LGBTQI individuals. So if you're working with individuals in the substance abuse programs, and also whether you're in a hospital as well too, what's on the walls, Also, is there any poems that are written by LGBTQIA reflecting the way that they feel and that have recovered and show hope and promise, of their recovery and their counseling and what it is and what they're feeling? So that's one of the things too as well that's important, that you could have an individual do or a staff member as well. So some of the community engagement, supporting the LGBTQIA relevant events in the community through sponsorship, staff support, advertising and distribution of announcements, and by co-sponsoring their events. So I know some of you Florida might have a Pride, which a lot of people come together and support as well too. So having one of your individual staff members, go out there and be a part of that, advertising, distributing announcements, and co-sponsoring if you are able to some of the events. So some of the individuals you're working with can see that, maybe you want to take a picture and put that on your wall, you know what I mean? So they can see that piece of you supporting and it'll be more affirming and more knowing that you're more of an ally. And what an ally is, because some people might say, well, what is an ally to the LGBTQI, population? And an ally would be somebody that supports and wants to seek to understand the population and wants to help them. So they're an ally and great support. It could be a mother, it could be a father. So that's another thing of being an ally. It could be a friend, but one of the things is also getting your organization's information out there in that particular community by co-sponsoring their event, by putting your name out there so they know when they do see that, they're like, oh, okay, well, they're friendly, they're LGBT affirming, and very supportive. So maybe I might want to go to their treatment facility or their hospital. So one of the other things is providing an information booth, at the LGBTQIA related events. So if there's a speaking event, there's a pride event, some type of huge event, you want to get incorporated with that, and be a part of that. Also provide education forums and programs that support the unique needs of LGBTQ community. Also examine, forum on transgender case or those on sexually transmitted disease. So not specifically just, on pride events, but, different forums that are out there to send either yourself or another individual in your organization out there to attend and put a face to name so you're recognized. So one of the things I was going to put out here is a vignette. I know we already had a little bit of discussion before about different things, but for this one, I wanted to go ahead and put a vignette out here for you and I'm going to ask your thoughts afterwards. So I'm going to go ahead and read this. Janice is a 25-year-old African-American transgender male to female person. So a lot of times, really, let me explain that. So male to female is somebody that is transitioning from a male to female person. Okay, so basically they were born male, and now they are transitioning to a female person. And it's M to F is what it's called. And you might see that sometimes on your forms. If you ever see that in an intake that says M to F or F to M, that's male to female or female to male. All right. So Janice is a 25-year-old African-American transgender male to female person presented to the hospital following an altercation with her new lover, Tony. She reported being thrown from the third-floor balcony by Tony, who thought she was born female. During their tries, Tony found out that Janice was transgender. Janice suffered several broken bones and injuries. On the front of the chart, the patient was listed as male, but preferred to be addressed as Janice. She requested that only female medical personnel entered her room. A third-year male resident physician was assigned to care for the patient. He required that a female medical student accompanied him. It was very apparent that the patient and residential physician were uncomfortable during the encounter. Janice never made eye contact with the resident physician and would only speak to the student. On leaving Janice's room, the resident physician referred to her as a she-male, and Janice overheard him. It was discovered that the patient was HIV positive, refused to take antiretrovirals, and had little to no family support. So my discussion questions to the group is, what is the best way to proceed in this case, with what just happened with this person coming into the hospital? Or you can look at it also coming in for treatment, Also, how can a barrier to care be identified and overcome with Janice? And also, how could the resident physician be more cultural sensitive? So right now I want the group to focus on 1 and 3 because I'm looking at the time. It's about 7:44. So I want to go ahead and look at what is the best practice to proceed in this case, and also how could the resident physician be more cultural sensitive? So I'll give you all a couple seconds to kind of type in on the right side where it's the Q&A to go ahead and put what is the best practice to proceed in this case. Okay, so you can write your comments in the right-hand side. And then also some of you wanted to go ahead and also see how could the resident physician be more cultural sensitive. So think about that. I mean, that's a lot of why you all are writing your questions. This happens throughout in every single state, and what I mean by that, there's different cases that come up. All right, so is there no, okay, let's see, from on demand, is there no female physician to work with this client? Okay, so in this particular one, it was stated, let me see if I can go back, that the person that would be, let's see, okay, I can't go back that way. There's the slide, I think. Yeah, there's the vignette. So it said that basically the female medical personnel entered the room, that she only wanted that, but it was a male resident that was assigned for care. So, and then also he required that a female medical student accompany. It was very apparent that the patient was and resident physician were uncomfortable during the encounter. Yeah, so I have a couple different things that were on here. Invite person to discuss how they did. So somebody had put, let's see, invite person to discuss how they identify, which is correct, and what that means for them. So one of the persons says how that person identifies. So yes, when that particular individual came in, how did they identify? So if everybody's wondering, like, what does that mean? A lot of in the LGBTQIA community, identification is important. So whether they're gay, they're a trans person, and a lot of my colleagues like to be called trans people instead of transgender person. But also if they're intersex, which intersex meaning that they have two different set of genitalia, which they could have. But yes, that is correct. Invite the person to discuss how they identify, and ask them that. All right. So then I have another person that says if it has to work with her, introduce himself, explain that he is the only doctor that can see her today, treat her as a female with respect, and say that a female will always be accompanying him. Basic respect goes a long way. So this person could be specifically, traumatized, with all this. These are wonderful, wonderful comments to the group. There's quite a few different ones, so I did want to address a couple. So yes, also I have the physician should not use labels when identifying the patient. Okay, so yes, there's a mixture. There is a mixture of different, and very good to everybody that's answering these questions. So going through these, let me go ahead and get back to our vignette, and then also, I'm actually going the wrong way, I'm sorry. So the question, of course, is what's the best way to proceed in this case? I think a lot of the stuff that we discussed, with some of your guys' comments is huge. I do see some others, having a physician be trained also in cultural competency, that is huge. Yes. So yes, how could the resident physician be more cultural sensitive? Of course, training is very important, and also what's the best way to proceed. But yes, I would say somebody also put, to introduce themselves. I really like the person that had put explaining that he was the only doctor at that time, and addressing her and respecting her as the right pronouns, which pronouns are he, she, they, them, with respect. So with respect to time, I just wanted to take two of the discussion questions. We're going to go ahead and, like, everybody that's putting the discussion on the side, that's awesome. You know what I mean? Of some of the discussion you all are having on the sidelines of this. So thank you for your feedback. So with respect for time, we're going to keep going. But yes, one of the best ways to proceed in this case, just to clarify, is also to go ahead and write, when they come in, for the most part, is asking everybody their pronouns, not necessarily just LGBTQ people, but all everybody, and how they identify, because just because somebody might look masculine or feminine, we need to get away from male, female. Doesn't mean they could be going through the change of being from female to male or male to female. So that's one, and also respecting the individual if they state that they are a female or male or intersexed. Also addressing number 3, how could the resident physician be more cultural sensitive? Yes, training is important. Also explaining, like we went over, he's the only one that is right, that's on site right now, and that, he will have a woman that will be beside him as well too, and letting that person know play by play so they feel comfortable. All right, so in respect for time, we can always go back and think about these discussion questions. Should members of the hospital be legally involved? And Janice's altercation with his partner. Also, what kind of supportive resources can you get for Janice? Discuss other cultural competency issues that may impact retention into care and treatment. So I want you just to think about those. So just think about those different discussion questions. But for the most part, those other two are the ones I wanted to really hone in on. All right, so switching gears really quick. I have a short video that goes a little bit along with that particular scenario, which I will have my host from FADAA go ahead and put forward. And one of the things is it's the right and wrong way to address LGBT individuals, which are clients or patients, but and we'll cue the video here in a minute, but it's the right and the wrong way. And kind of what we just discussed, is basically working with an individual, when they come into, whether it be your treatment facility or it be, the substance abuse program, outpatient, inpatient, sober living, detox, also in a medical treatment setting as well, too. So we're going to go watch this. It's about 8 minutes. Please make sure that you have your volume up and that you are able to view and hear this. And this is the right and the wrong way to go ahead and it kind of shows you proper etiquette in working with outreach and also really getting the point of what I'm talking about when somebody does go and needs to be treated. And the video should be coming up any minute now. So while we're waiting for the video, just know that the population has a history of trauma, so outreach measures are very important. Also for people going to the doctor and for, it might not be so comfortable, and especially for those that are transgender. So go ahead and pay attention to our video, and it's Vanessa Goes to the Doctor. All right, so let's see, make sure that everybody can hear me, and if you can, just say I can hear you. I went ahead and unmuted my, let's see. Yeah, so this video right here, just want to make sure everybody can hear me. 1 second. I can hear you. Awesome. All right, so this short video with Vanessa goes to the doctor. You know, one of the discussions, and we'll be taking a short break here in a second, but I did want to know some of your reactions to that, to all of you. You know, what are some of your thoughts, you know, and, you know, kind of discuss that. After this, we'll be taking a short break, but I think that this is huge. You know, when I talked about and kind of set the stage of things that were, you know, in the waiting rooms, and also the pronouns, and also speaking to them, and individuals that identify from different backgrounds, also cultural. She was African American. You know, also when they talked about preferred, be careful, because sometimes working with the trans population, sometimes they might just say, no, I'm not preferred, it's just I am, you know. So one of those things is important. Also, the right and wrong way, you know, of being affirming. It shows you the right way of the individual speaking, and going to the doctor, and assessment forms and things that need to change on our assessment forms, you know, and also making sure that you're everybody's basically trauma informed, and also being able to, when somebody comes to the counter, you know, properly knowing how to work with them. They don't have to be certified. They don't need to be a doc. I mean, as far as a doctor or a nurse, or, I mean, they could just be a receptionist, and being able to be affirming and accepting. And yeah, sure, even though it says, it might say Bob, you know, we're addressing you as Vanessa, you know, and also if there's any pronouns or any mistakes in identity, whether he or she, just to apologize and keep moving forward. All right, so I've got a couple, one coming through, very informative, learned some new things. I might add to how to introduce myself to new clients. So let's see, so Alexis, all right, so one of the things is, you know, I'm happy that you like that, because it's really an eye-opener for practitioners, counselors, peers, to actually see that video and what an impact it was. And you can also use that with your guys' groups as well, too. Vanessa goes to the doctor, like, you know, and you can always refer to that and show your staff, you know, and how to introduce yourself to your clients. Can you put a little bit more in respect to, you can be openly out if you are. If not, on my email, I have on my email that when I go ahead and send an email, I put pronouns she, her, and hers. You know, you can go ahead and put that. You know, as far as introducing yourself via email, but also in person, just introducing yourself. I just need a little bit more information in respect to what you wanted me to kind of go over. I also, it is embarrassing to see in real life similar scenarios, the eye rolls, the intensive to go by the legal name, etc., even after they have been to training. So, yes, so thank you so much for that comment, because I think this person is saying that even if somebody has been trained, they still are very not affirming and not accepting. So there's two different things, which is compliant, and then there's, you know, you might have some people that are compliant, you know, that work with you. So they're just, you know, basically compliant because they want a job, you know what I mean? And then there's others, you know, that are affirming, you know, that accept and want to help, So it can be very hard, to make sure that you get extra training. But just think about it, when we sign our code of ethics, whether you're a nurse, a doctor, a counselor, a peer, one of the things is non-discrimination, and also, sexual orientation. That, when we see that person come in, we see an individual. That's what we see, and we want to help that person. So sometimes we need to reevaluate if we have issues with certain nationalities or sexual orientations, that we need to go do our work as a professional, and maybe we don't belong in this profession, and really do some soul searching. So one more thing I see, it is so important to have inclusion in the workplace in order to create a safe environment for everybody. I agree with the person that wrote that too as well. It is an inclusion of everybody, culture, all different body types, whether you come from you are a plus size woman or man, or intersex person, or you are a very skinny person. I mean, all different nationalities. That's very important. So with that, I want to thank everybody for your discussion, the reactions. Please feel free to use that video in your staffing meetings, and also as discussion, as far as assessment forms, and training your staff, not only people that are certified counselors, but medical staff, staff that are happen to be working there for one day as temps. It's very, very, very important for that. All right. So before we dive into outreaching for strategies for Asian American, I'm going to have the host take over for a minute. I believe we're going to go into a short break. So let me get...
We are going to go ahead and take a 5-minute break. So we will be back at 11:11 at that time. So we'll see you guys back at 11:11. Thanks. Hello, Ms. Padilla. Are you ready?
I am.
Great.
Hello?
Hello, Ms. Padilla.
Yes.
Are you able to hear me?
Yes, I am. Yes, are we ready?
We are ready.
All right, awesome. All right, well, welcome back, everybody. Hopefully you were able to have a quick break, use the restroom, get some popcorn, get a water or soda, and if you, all that good stuff. So far, I know that was a lot of information and probably really had your minds thinking, especially with the video. But we're going to switch gears really quick, and we're going to start talking about outreach strategies for Asian American, Native, Hawaiian, and Pacific Islander communities, okay? We have about 4 different ones. Well, actually, it was 5 altogether with the LGBT community as well, too. A lot of information. So one of the things is adapting material to be appropriate for you, in the community. So, like, there are a number of, like, federal and state resources available for educating, individuals about different, different stuff, determining, basically if these resources can be more effective and that are adapted to your community. We talked about translating resources into your language, consider it putting them information in a format more likely to be accepted by your community. So in the Asian community, the Managor, I hope I'm saying this right, Managor-Mari County Asian American Health Initiative in Maryland, creates cultural and linguistic tailored health education materials. And what they do for the Asian American community is they not only have their stuff in English, they have it Chinese, they have it in Korean, Vietnamese, and Hindi. So think about that, when talking about the Asian American, community, and also Pacific Islander and Native Hawaiian, Also providing a personal approach. So, using flyers. We talked about, flyers, pamphlets, particularly if they are not in the appropriate language, is not sufficient for engaging, all the communities, but also, sometimes relying on the trusted members of the community to answer questions and concerns. I know out in Colorado, there's all this is on a national level. The Asian Pacific Development Center, they have community members to schedule meetings outside, the standard working hours to set up meetings with the community. So that's some outreach stuff besides just you being at work, of actually engaging, and setting up scheduled meetings with your staff, yourself, outside the standard working hours to set up some meetings in the community with the community leaders. It could be anybody that are having groups that are having, different ceremonies, rituals. Also, just there's a variety of different stuff providing more of a personal approach and getting more incorporated for outreach. Also, employing staff, one of the things, use a behavioral health peer model, employing staff that reflect, the diversity, communities that can lead to increased trust, flexibility, and knowledge of the community needs, Peers are effective in doing, outreach and engaging others because of their personal experience. So I know as professionals, we might have our license, we have our master's, our bachelor's degree, But don't forget about the peers, because they also have a lot of personal experience along with us too, and they have committed to like working with others who have similar lived experiences. I would say like the Asian Pacific Family Clinic in California relies on bilingual, let's say for instance, peer staff, just to give you an example, bilinguals, peer staff to help educate and engage community members in their health-wise integrated, health systems, whether it be substance abuse, any kind of behavior health or medical health, and also like the Filipino American Service Group also uses a behavior health peer model to assist homeless, and others through individual service plans, case management, and job training. So don't forget about peers, as we have our, different, walks of life and different kind of degrees and also certifications and licenses and stuff. You also don't want to forget the peers, that have similar lived experience as well. And, and also the case management part and job training is very important as well, too. So using language familiar to your community, basically ethnic groups, if you think about, there's like 30 different countries that speak over 100 different languages, okay? And some of the communities have a few native English speakers, so it's like essential to have on your staff, when you're reaching out to provide bilingual staff to help individuals understand it and, enroll in the treatment facility, enroll into the medical hospital, wherever it is, so like, you might have a special service group, in Florida that employs multi-ethnic, multilingual staff members who communicate not only just English, but can Hmong, Japanese, Korean, Mandarin, Samoan, Tagalog, Taiwanese, Thai, Vietnamese, and I mean, there's a list that goes on, so there's a mixture, it's not just, hey, there's Asian Americans and Native Hawaiians and also Pacific Islanders. We've got like 30 different countries and ethnics imagining, in Florida, and so that's one of the things, as far as, using language to familiarize, to be familiar in the community. So another part is incorporating community perspectives. So, ensure that you're staffing yourself with the community and aware of, traditional customs. Even though we're moving into almost 2020 here, there is a lot of people that still have traditional customs, and that take, into consideration local politics that you need to take, besides traditional customs, traditions, social, political histories, also develop strategies that take into consideration, like I said, local politics, religious beliefs, immigration status, and historical experience of the community. I would say, Asian Americans for, community involvement, basically they hold meetings like every Thursday. So is your group holding meetings? I mean, that's how you can engage too and reach out for a strategy and hold a meeting at your facility. That's a whole huge engagement. Put posters, there's Starbucks, there's different community places that you can post your meeting in, and what you specifically are putting out there, what culture, or if it's all cultures, is there specific something that you want to engage in a topic, and put it everywhere, do an e-blast, there's that part too, there's constant contacts, there's, ways to get things out if you don't have, there's Vista Print if you need to print some brochures that are really inexpensive. But another outreach strategy would be, this is, you could do a dinner, and discuss and engage the youth, and people that want to and are interested in supporting community activities, invite some panelists, that talk about the subject, to provide like expert opinions to the audience members. You can bring like professionals into, from the community. So, that's huge, and you or yourself or somebody could go out there and, engage the community by bringing these leaders in, also community experience and expert, opinions into the discussion, about activities and strategies, promoting that individual's care, whether that be them struggling from substance abuse, being, where you work at, in healthcare, because a lot of people that are coming in or like locked up or any of that stuff, a lot of them are struggling through some type of substance or addiction. All right, so we're going to head to the next slide. So continuing on this, partnering with your community organizations, so reaching out and partnering, it's important, really take this down as, the community programs that are out there. Is there a YMCA, is there, what schools are out there? Let's talk about the hospitals. Also the places of worship, are you also going out there and partnering with them as well too? There's also cultural centers to maximize the outreach. So the outreach to go to some of the cultural centers, there's Google, go ahead and go Google some. Also if there is community health, for Asian Americans in Florida, you'd want to reach out to them, and attend some of their meetings, So there's a lot of collaborative relationships that you can go ahead and make, but also partner with, that's very important. So integrate your message into the community events. So provide opportunities for individuals to learn about, your treatment facility, your hospital, if you're in private practice, if you're, a practitioner practicing, a medical doctor, I might have a variety of different people on this webinar. So, there's different community events, like I said, that you could go to, with some of the community leaders. There's also politics, that are out there as well too. So, reaching out to the mayor, also, different places that you might want to attend. So, and be, that's in your community, that, events are any kind of celebrations, All right, so create a central location for resources. So like, have yourself a resource library, in your facility, or, place of employment, for these individuals. So for community members to access, that information, is it a binder? Is it a website? Is it a tablet that you put out there, a laptop that they can go ahead, or the easiest would be a binder of all different stuff that somebody could be involved with, whether they're outpatient, inpatient, that they might just want to come to your facility because they're like, hey, I got some really good information, at this one place, and then they bring more people. So you're doing even outreach by mouth because there's other meetings and activities and events, like you're going to be the place to go, or maybe like as far as like a posting of events, they know what's happening. So creating a central location for resource, you would have to figure out where you'd want to put it, how you'd want to put this. It could be online, where it's located, so your staff or the individual could access it. But also in doing that, please be mindful about offering cultural and linguistically appropriate information and services, okay? The next one is use media as a resource. So to expand your outreach, use media, local talk, radio. You can, as far as some outreach strategies, you can use talk radio, television programs, church or temple newsletters, and cultural magazines. There's also electronic media, such as local websites. Don't forget your favorite Facebook group pages, text messages, if you have phone numbers. Emails can also be a very effective way to reach out to your audience. Ethnic media outlets as well too. There's that. So addressing barriers. So be aware of challenges that could keep individuals from receiving information. So you want to think about barriers, like what they wouldn't get. You know what I mean? So understanding the information, how it is to get to treatment, or where your place of your office, the hospital, what could be some of those. Well, there's things that you can do and set up for free bus passes, Ubers, Lyfts. There's all kinds of different stuff that you can do as well too. Integrate, a mental health consultant as a part-time of your staff to communicate with the children development center, if you have one in there, in this familiar environment with families, and more likely, to talk about more of their things that come up for them for the most part, if any barriers to get to any of these outpatients, inpatient treatment facility. All right. So the next one, and I'm looking at the time really quick, so we're going to whip through a couple of these. So outreach strategies for Latino and Hispanic communities, okay? So, so some of these different approaches too, as well. Also I'll talk about translate resources. Consider yourself putting the information into a format more likely and acceptable in that community. Also, education, to Latinos in the border regions, that are coming over is one thing. So just make sure the material is appropriate for the community. Also providing the personal approach is just, there's a lot of diversity within the Latino and Hispanic communities. A one-size-fits-all approach is not likely to work, so make sure that you're hiring bilingual diversity or staff from the community to help build understanding and trust into the outreach and, enrollment efforts for them to come to your treatment facility. Also, community members nationwide, to serve as facilitators if you needed to, and those community members can support decisions with immigrants to improve mental health, quality of life, and also to engage in their own local community. And using a behavioral health peer approach, the peer model, also we talked about community members bringing them in. And, as far as their outreach, so just making sure your staff reflect the population you're serving as well, not all, but some, as far as ethnic language, social, economic status, also, if you have peer specialists to place, of worship in the community, also, support workers, also that go out to Sunday church services that can spread the word. And they're able to answer questions. Number 4, let's see, language familiar to your community. So providing assistance in Spanish is important, reaching, some of the Spanish speakers that are limited and English that aren't proficient, So that's one of the things that's very important too as well, that you want to go ahead and make sure that you get somebody that can translate when working with the population if they're not too good with the English, and also that, serve as a liaison, between whether it be health and social services or any type of, community outreach efforts or any of that stuff. Basically one of the things is so they can feel heard in their language, engagement community members on their own terms. So one more thing, hold on, it's the next slide, I believe. Give me 1 second. Outreach, let's see. Continued is partner with your community organization. So maximize your outreach, also, like I said, schools, hospitals, churches, cultural centers. We talked a little bit about that. Also we talked about, as far as hosting community events, health fairs are really huge, are very effective with the Latino population to engage, a broad range of Latino community members. I know in New Mexico they organized some different, in Albuquerque, the Center of Hope and Recovery organized and hosted a health fair that was very successful, and a lot of people came. So provide, basically safe, trusted venue for businesses and individuals in the community to learn about and discuss health, all of the above, any problems with substance abuse, and putting that out there as well too. So also communicating, directly with, community members, ensure that the outreach campaigns reach individuals and families in places that they already go. So, like we talk about schools, doctor's office, homeless shelters, don't forget about the homeless shelters and public transportation. Are they on buses? Are they on trains? What's the system, cabs? And on communication channels, the regular access, which could be internet, television, radio. So outreach campaigns using cultural appropriate and in-language messaging ensures, that are understood. And, you might want to put some of it in Spanish and some of it in English, that are aimed to Latinos, So another thing, as far as media resources, it's the same thing as about talk radio, television, and then also addressing barriers, be aware of the challenges that, could include, which is childcare challenges, homelessness, inflexible work schedules, lack of transportation, Some other barriers, low level of reading comprehension, so the need for English transition is huge, and they find that more the immigrants and the families in the area due to like immigration status and fragmented, basically, health services. So that's one of the things for working with, the Latino population and reaching out to them. Let's see, our next slide is actually outreach strategies to African Americans. So in the African American communities, their diversity among, the African American communities across the nation is also not a one-size-fits-all approach either. So one of the things is reaching out, with people. What they've done before is, providing, stories behind photographs, helping to promote, different dialogue and insight to different, community members. What materials, basically, do you have when you first walk in? Do you also have some African American, is there sculptures? Is there any of that stuff? Is there different language? A lot of people, there's Kenya, there's Africa, there's a whole bunch of different languages as well spoke there as well. So providing a professional, approach, opportunities for these individuals to speak directly with staff is hugely, with working the population, is getting to know the individual. Also building rapport is huge. Offering to help, complete like applications with the individual, paperwork, answering questions, one-to-one. There's also a place called Project Brotherhood that's really an awesome place too, if you look that up, and it's actually out of Illinois. They hosted a health clinic as well at a local barbershop, so that actually worked for them, getting their hair cut. So that was really effective, for outreaching in the community, and the African American community is at a barbershop. And then also, they dressed down, and they didn't dress all professional. They dressed down in basically T-shirts, sweatshirts, denim shorts, and this allowed more of a personal interaction with the community members, and they found that more effective with the African American community. And so another thing, the involvement community members in outreach, your staff, once again, should reflect population you're serving, whether it be ethnic, language, nationality. So it's so important to be employing staff within like the same communities, okay, in which, they live and lead the, increased trust, flexibility and knowledge of the community needs. One of the other thing, of course, using a familiar language as well too. So, adapting, for your community. If you do need to translate anything, like I said, there's a lot of different languages also spoke as well too. So some of that is very important. Also look for coalitions, community-based organizations, that could go ahead, whether it be radio, and use other like cultural approaches to create like a series. You can do stories, different stuff that have been affected and effective, with this population of overcoming substance use, and really positive stories that's happened in the community, whether it be the ghettos or unserved populations, for radio, television, and in the classroom, that they've overcome their addiction and they're still in recovery. Another thing is engaging, community members on their own terms, which we talked about as far as having staff willing to be able to meet the individuals outside, of the standard working hours. So not always can people meet at that time. So that's important too. As far as partnering with, your local organizations and stuff, that's important. Integrating your message into the community events and being out there. They, whenever there's like a Martin Luther King march or any kind of, African American month, that's important to get out into your community and support these individuals as well too. And learn about them, learn about the culture, learn about and be in it, and be able to talk about that even if you're not from that culture with the individuals that you're serving. That's a huge resource as well too. You can also, as far as creating a central location for services, anything, getting a binder, Also send emails out, use them, do media and resources as well, address any barriers that this, could include, which could be homelessness, like we talked, lack of child care, influx as far as work schedules, not be able to make it between 8 to 5. They might need to see you from 7 to 9. Lack of transportation, also low levels of reading comprehension. So there's a lot of support groups that are out there too. One of the things is that, if you do have a place, you can also, offer snacks, phones, literature, and games while they're getting services or information that, at your facility or any other places to actually, as far as outreach, like, oh yeah, while they're waiting, I know I'm going to get a snack, or, there's literature that I'm going to read, some books, and maybe I can play some games. So they also, with this population, more peer companions are able to, assist as well, too, as well. So our next one is outreach strategies in American Indian and Alaska Native community. So one of the things is, in this particular community, as far as adapting material to be appropriate for your community, is basically making sure that, of course, your staff is cultural competent, and get some type of understanding and aware of the cultural, values of this particular group. Integrating culture into your outreach approach is huge. Like basically there's a Masalu Indian Center in Montana that provides like cultural sensitive training. So if there's not training specific in, whether there's quite a lot of different training in Florida, but I also want to urge as far as if you need specifically, training on different stuff, if you're not able to, it's always important to always ask for help and reach out, and there's different states around as well that could help out, and providing a cultural sensitive training to, community assistant programs or, who you're working with the American Indian client, So providing a personal approach to this community, using mail service is huge. It's been, distributing pamphlets is not so sufficient for engagement, especially for like persons who are homeless. These individuals like the person to person. They like the availability to talk to one another and really discuss questions and concerns with this individual that you're working with. They like the person-to-person approach. So once again, we're talking about American Indian and Alaska Native, communities. There's also Helena Indian Alliance in Montana. They also employ like patient advocacies, which are awesome, which develop and maintain relationships with the individual interested in enrolling, in their treatment facility or, medical assistance. So the advocate kind of walks them through individual, like the application process to assist them in their paperwork and helps them, through their stuff. So like First Nations Community Health Sources in New Mexico, they talk about, insurance is very interesting. Every state has different insurance requirements, at the time of the appointment, So having somebody out there to be able to do that from, their same, whether it be American Indian or Alaska Native community person, just as a peer would be awesome before they got back to you for treatment, as far as, whether it be detox and, inpatient, outpatient, to help them fill out their forms, that one-to-one approach that they feel heard and listened to, and help assist while they're either in the clinic, in the hospital, or they are seeking service for substance abuse as well. So another thing is designating maybe an enrollment specialist, that's there. You can call it whatever you want to, a peer specialist, a person that's your outreach. It could be somebody that's not certified or anything. They're just an outreach person. And, that can, basically lead your organization, outreach for individuals. They should be knowledgeable, definitely about your state regulations in Florida and, any kind of enrollment process, whether it be an intake, application, any of that stuff. So that's one of the things that's important. So also one of the other things as far as like any kind of barriers, they could probably talk with them, that individual, why they're scared or why they haven't came to see, and feel comfortable until the professional gets to them whether it be they're in crisis for whatever reasons, at least sit with them. With this population, they like the one-to-one, face-to-face approach. Okay. So one of the other things is partnering with your communities, going out there, engaging with the neighborhood. The tribal programs is huge for tribes, the schools, hospital, churches, but I do want to reiterate tribal programs is huge, you know what I mean? Partnering with them and the agencies there to expand your outreach efforts is huge, and find out what particular tribes that are out there in Florida, you know what I mean, and learning a little bit more about whoever, going out to some of the functions. There's like sweat lodges, you might have somebody that is from that culture to go out there and meet with the population. There's different locations in Florida that have native, there's reservations, there's different stuff, and if not, then to get more insight for somebody that's either Native American, or you can reach out and, for anybody in specific, whether it be Colorado, Denver, Indian Health and Family Services, and the services that you have here in Florida, are phenomenal as well too. Also integrating your message into the community events, the Native American, Rehabilitation, Association, whether it be in Oregon or Florida, reaching out to your Florida people and asking, all about, different events that are coming up, with Native American people, Osco, Alaska, also, the Native kids, be reaching out to them as well, seeing who participates in some of the events that are sponsored by, some of the Native-owned businesses, maybe, and also community powwows. So some of the powwows that are out there are important as well, too, to go out to and be a part of. And not always do you need to be invited, but you can show up. But it would be great that if you were invited, to be a part of that. So people start to see you, and the more community is driven for the engagement for the people that you're helping. All right. So some of the things I wanted to talk to you about, and I don't see any questions yet in the Q&A, but please feel free to do so with any of the information that I just presented. But in doing so, and I'm looking at the time at 8:44, I'm going to go ahead and, as far as breaking down barriers, what do you think keeps individuals from treatment? Like, why do you think people do not want to go to treatment? There's the other questions, which is, do you believe that there's a lot of stigma with those individuals who abuse substances? And how do you address justice-involved individuals and have a record and have a hard time getting employment due to their records? So because of the time, we have about 15 minutes left. I'm going to go ahead and see if anybody wants to take a stab of why, what do you think keeps individuals from treatment? I'm going to give you about 15 seconds because I want to make sure I get through some of my other slides as well. I'm asking the audience now, why do you think, this keeps individuals from treatment? I see some people, okay, so because people do not understand them, somebody says, okay? Thank you, by the way. They do not want to explain their lifestyles to strangers. So yes, that is absolutely one of the reasons, yes, that sometimes a lot of people do feel not understood, and then having to tell your story and explain their lifestyles can make them feel in a certain way. I also have somebody else that says fear. A lot of times is fear. There's an acronym for fear. It's face, I got to remember what it was. But it's like face your fears, basically, in a nutshell. I have somebody else that says access to care, example, rural populations who don't have transportation, which is true, because some people don't. So that is lack of transportation and that lack of resources. So with that, those are wonderful comments. And, individuals that are being kept from treatment, I would say all of that, some of those are barriers for them. Just going over that again is lack of resources, that they didn't know they could get it, or they don't have the insurance. Also, I see somebody put, difficult asking for help. Absolutely. We've got this thing called pride. So we want to endure in our individuals that we're helping that to get out of the way of our own self, because pride, it'll kill you. So yes, and also lack of trust for somebody to have to trust, especially in a cultural era. People don't really talk about their feelings sometimes. I mean, our new millennials and different people, we're putting that more out there, but there's a lot of stigma behind it. So thank you. Forget everything and run. So yeah, fear. Thank you for that, Kevin. So fear. So some people do forget everything and run. Yeah, and then also, Lisa, thank you. Face everything and rise. I've heard both of those. So please, when you're dealing with and working with these individuals, fear is, face everything and rise. And then some people on the flip side forget everything and run. So thank you for that. So respect for time. And and also I have face everything and recover. That is true as well too. That's huge. So we're going to go ahead and transition. Like I said, I have about 13 minutes left, so there's some stuff I want to dive into before this is over. So looking at this right here, and, sources and data notes if you want to go to is at www.prisonpolicy.org reports. This is the pie chart of everybody that's been locked up. How many people are locked up in the United States? We're shifting to the criminal justice slide of working with the criminal justice population. I think, I see somebody says they love this slide. That's awesome. I'm a really person that likes to see things, so I thought this would be great to see about local jails, state prisons, federal prisons. How many people are incarcerated in the United States? There's the drug trafficking on the side. There's other public, views. There's sexual assault, homicides. There's all the different stuff that are broken down in the United States, and people are locked up, so it's got like a little bit of a pie chart here. And why the U.S. is the first to consider types of correctional facilities, to 2.3 million people, are confined here. So that's for you to go ahead and take a look at. I'm going to go ahead and dive into my next slide. So some of the tips of outreach with working with justice-involved individuals. One of the things is the community providers are knowledgeable. These are huge, like the first principle, the criminal justice process starts at like the point of contact with the law enforcement officer, right? So such contact may result in an arrest and entry into the criminal justice system, including prosecution, pretrial services, sentence, sanctions, and corrections, which lastly involve basically with jail, prison and community supervision such as parole, probation. So understanding the criminal justice system can help the community provide, facilitation continuously and coordinate treatment and service for justice-involved, individuals with mental health and substance use disorders, This understanding also helps providers know where it is, in the criminal justice system and with, what criminal justice personnel their individual or client is currently involved with. So, understanding the system also helps community providers recognize where opportunities exist to divert clients or individuals into treatment and service, both before, after, and entering the criminal justice system. So community providers also collaborate with the criminal justice professionals to improve public health, safety, and in doing so, speaking about, the second posting is collaborating, between community providers and criminal justice professionals. It's so important. These are huge tips of outreach with, working with, justice-involved individuals. So basically the collaboration between the community providers and criminal justice professionals is essential for enduring, continuing of care and care coordination during transition to and from incarceration, sustaining treatment and support both for correctional settings in the community. So, just clarifying the roles of responsibility, for treatments, supervision efforts, and stuff like that, and working collaborative with the individual to meet their treatments, and supervision goals, are a cornerstone of effective partnership with these individuals, okay? So, I can't say enough of working and partnering with parole and probation can facilitate, like, coordination of care is huge, and it's a supervision requirement as well. So let's talk about evidence-based and promising programs and practices in and behavioral health treatment services, and are used to provide high-quality clinical care for justice-involved individuals. So basically, evidence-based, programs and practices for substance use disorders should be for all individuals, specifically, to justice-involved when appropriate, basically. So practices such as, criminal justice thinking, criminal thinking, not justice, criminal thinking, through cognitive skills, trained, focused on judgment and criminal behaviors, Treatment should be like tailored to the individual and address motivation, problem solving, skill building, to improve, cognitive, social, emotional, and coping skills, and assist to pro-social support and activities for these individuals. And where needed, integrate systems for co-occurring mental health, substance use disorder should be provided also in coordination, of care. So another thing for community providers understanding and addressing criminogenic risk and need factors as a part of comprehension treatment plans for justice-involved individuals. Basically, criminogenic risk is a likelihood that an individual will engage in future illegal behavior in the form of a new crime or failure to comply with conditions of parole and probation. So the factor of the increased supervision will likely, they would re-offend. So such as lack of employment, is that's something huge, or the presence of, the substance use disorder is huge too. So, any kind of intervention would be effective. I think, as far as evidence treatment for justice-involved individuals, include evidence-based and promising programs and practice that addresses the individual's mental health illness, substance use, and getting back to the needs and factors and the risk that's involved. I would say research basically indicates that behavioral health treats, alone does not just reduce recidivism, and controversially, interventions that address only criminogenic risk and need factors do not improve behavioral outcomes. You know what I mean? So it's important to include evidence-based and promising programs that practice and address individual mental health needs and substance use disorders as well too, and needs and factors. So the other thing is integrating physical behavior health, is something that's huge too. Formerly, incarcerated populations are, an increase of risk of serious, complex, chronic health conditions. So treating, somebody behavior healthcare with the community, the community provider can, offer a whole person care that is coordinated, with the individual, as far as engagement to improve, access to engagement with services, and where needed, integrated treatment for co-occurring mental and substance use disorder along with them, whether they've been locked up or what have you not. So one other thing, let me get back to that. Sorry about that. So that's just a little bit about working with some of the criminal justice population. My next slide is working with individuals who are homeless. So what has worked and what has not worked? There's shelters, there's food, there's clothing, there's counseling, there's mental health. There's a lot of people that are out there. We have about 6 minutes left. So working with, individuals who are homeless, one of the things is assessing for the need. The engagement of actually going out to the shelters. It's important, making a list that your outreach tech or your person, your counselor, is making a list of the different shelters and, outreaching to them. And if your facility or your place has extra funds to be able to donate to these individuals, that'd be great, and finding the need of what they need. Also, providing counseling or mental health to these individuals that are at these shelters are huge. That outreach is big. A lot of people might go to the homeless areas in your neighborhood. I don't suggest to go by yourself. I'd go as a group and outreach that way. Go to the next slide. So switching really quick into youth, because that was actually the homeless part of my presentation of shelter, of actually identifying the needs and outreach. And also, sometimes police have a list of people as well too, that they've worked with, whether it needs to be, some people do outreach and give out clean needles. They do, as far as condoms and, do prevention. But, a lot of the things is just make sure that you take a group of people and not by yourself, because it could be dangerous, as people are hurting. Hurt people, you know what I mean? So sometimes, not always do they, but sometimes they are. So having an understanding of people that have been homeless for a long time or are suffering and off their medication can be quite dangerous, because of the fact that maybe they need some type of antidepressant, or they need to work through some depression, not necessarily needing medication, but it's always good to take people with you, not by yourself. All right, so transitioning into some topics is about, here's some discussion questions and topics to help you with youth. Some of you might, some tips and also some outreach to youth groups, or actually in your session when you're speaking to the youth, or maybe you might even, be wanting to reach out to a school and also to a hospital or to a community organized group or a church. Some of the things to create interaction and outreach with your young adolescent population. I went ahead and gave a series of different questions that you can go ahead and engage. I'm not going to read all of them, but I will say this, to go ahead and engage with them. What three major problems do you think, for yourself, young people face today? That could be in a group atmosphere, and an individual. What do you feel about the poor people and, in the world? That opens them up and directly, starts to speak to a whole bunch of different stuff than, hey, you relapsed or you overdosed or you're having a hard life, you're this, that. You open them up a different way. You know what I mean? Also, you can talk about if you could personally witness any event in history, which one would you choose? So you tap into some other cognitive thought process before you go into, they had a bad life and, their mom's on drugs and all that other stuff, to actually engage with that youth. You talk about something else sometimes. You talk about, what's things that don't exist that someone needs to invent. What does that look like? Maybe they might talk to you about, they want a roller coaster, that goes to the moon or something that they just think off the top of their head, or, tap into some of that other stuff, to get to reach to these youth. Some of the other stuff is like, what do you think asking a youth this question is hilarious. What do you think is the biggest problem in the United States and why? They'd probably talk about cell phones or, no use of that, not having to get a job or something. Who knows? The millennials is a whole different decade. But, this is to open up youth, And, also you can dig a little bit deeper. What kind of wrong, conclusions do we reach when we judge others by their looks? And that's really taking a look at themselves and saying, how do they judge somebody and why are we judging? So you can go into a whole bunch of other stuff, and here's some more too as well. How would others, very well describe you? Like, how do you think that they would actually be looking at that person? Some of them would be like, I don't know. So I do see something on the side really quick. It says there are not enough shelters for everyone here in Florida. Every time that a client needs shelter, it's difficult to find a bed and then expected. Some shelters, don't have good transition. So yeah, they need to have a better, stronger, shall I say, case manager to help them. Some is shelters, they don't have training, seeking employment, financial support, and rent. So that's what would be great for the shelters, or someone to have a case manager to actually facilitate that and find all of that. That'd be great. So, I also saw somebody say, if I had to give, every human being one quality, I would choose kindness. Kindness goes a long way in the world. If we all had it, it would make the world a much better place. And that is true. Thank you so much for your comments. So these are some of the stuff. I see we're gearing up tonight. We'll probably go a couple minutes over so I can conclude this. But I do want to wrap it up. But at the same time, make sure that you look through some of these questions and engaging some of the youth and some of the facilities that you work with, not necessarily needing to use these questions, but you might go buy a book that it's like 100 questions, like if you had $1 million, what would you spend it on? Or, starting at that capacity first and then going, whether it be clinical, medical, substance abuse, and then talking about what's going on in their life and how they got there. So also, here's some more questions as well. What's the best thing that happened to you in the past week? You can talk about that, and there might not be nothing, or might there be something. You flip it around and say, now I need you to say something positive that's happened to you. Also, if I gave you $10,000, what would you spend it on? So that's a little bit how you can engage with the adolescents. And then we have a couple more slides about family, the family, working with family-centered approach with working with families. And youth is at the core of good family-centered practice. To conduct assessments, case planning, and case management is successful. Case workers must be skilled in communicating, which is huge with children, youth, and families to help them strengthen interpersonal parenting and problem-solving skills. And that is very important about the parenting part, because there is a difference between partnering and parenting, and it is important that a family-centered approach, that's huge in groups. So continuing as far as strength, element of effective work with families include engaging families and youth, so everybody, it's a family approach, providing direct assistance with, challenges the family face, including like counseling, if they don't want to go to counseling, kind of find out why. Has it been something bad in the past that came to you, or are you afraid? What are you afraid of? Or kind of figure that piece out. Also, parenting coaching that I talk about. There's a difference between parenting and then partnering and coaching. That you're coaching this person, coaching these people, and coaching your kids and coaching your client. And then also modeling the behavior, and then continuing and assessing with the family, their strengths, their needs, and their progress. Always want to go through, and as far as pull out their strengths and the needs of the family, because a lot of people can pull out all kind of other stuff, but really stick to the strengths, needs, and progress. So really quick, as far as time for review, we talked a little bit and actually talked quite a lot about the criminal justice population, working with different communities, and the background of nationality. We talked about the LGBTQIA and learned a little bit about that community. Also what culture is and why it is important to have evidence-based studies, but at the same time, understanding it and understanding the different walks of life that individuals have when they come into our office, and how important that is understanding them. So, food for thought. I want everyone to have a wonderful day. I want you to review this PowerPoint and also when it's made available, and really think about all the things that's been said to you today, and also the video and how it impacted you. And even after this, write a reaction paper. Write your thoughts in a journal. Write what you got out of this, and really think about it and how you can practice this and use it to your ability to become a better professional, and for you and your personal life. So with that, I'm taking any questions. I also, after this, have a reference page on my slide 45, 46, and 47. I don't know if anybody has any questions, but I'll leave it open for a little while. Donna, thank you. Thank you so much. I enjoyed it. Awesome. I love to hear that. My whole approach is to open your mind. Sometimes we're set in our own ways of, we're change agents, so to speak. And sometimes we don't like change. But the thing is we need to adapt and learn how to adjust and also learn more so we can be better and do more for our individuals that we're serving. So I'll stay on here for a little bit longer to see if anybody has any questions for me. Once again, please do review these slides. And I want to thank the sponsors of this event as well, as they were remarkable and I enjoyed working with them. But also do want to remind the participants, please review this PowerPoint. Please take whatever I've given and talked about with all the different cultures, and make yourself more confident, in this field and your profession. And if there's something that you're interested in being a specialist in, make sure that you're reading about 15 minutes a night and educating yourself as a professional. It's so important to keep educating as we have continuing education today. You want to keep continuing, not just because we need continuing education units to renew our stuff, but also it's, our obligation to ourselves and for us to do better in the profession. All right. Thank you, Gregory. Thank you. And also, Donna, I'm glad that you enjoyed it. You too, Kevin. Appreciate your time and the time that we spent together today. Anybody have any questions? I'll go ahead and stay a couple more minutes. Thank you, Donna. You too. All right. Thank you, Terry. You're welcome. Yes, thank you. I really enjoyed the rigors of the LGBT community engagement. Yes. All right. Well, thank you, Alexandra. Thank you, Lori. I'm glad you all were able to take some good stuff from this. Take it and make it yours. It's all about a learning process. All right. Well, if we don't have any questions, I want to thank you all for your time. I really appreciate, once again, the state of Florida. I really appreciate their time, and I appreciate being able to share this information. Once again, thank you to the Florida Department of Children and Family. Their MYF, I believe it is families.com, and also FADA, which is the Florida Alcohol and Drug Abuse Association. I want to thank them, being that this was sponsored by the Florida Alcohol and Drug Abuse Association in the state of Florida, Department of Children and Families. And I want to thank you all for your time. I really appreciate it. And don't forget about your valuation. I'm going to turn this back over.
Thank you, Ms. Christina Padilla. This has been wonderful presentation, and now we would like to conclude with a couple of items of business before we conclude. When I conclude today's webinar, your browser will take you to an evaluation on FADA's new website. If you want to receive CE credits or a statement of credit for this event, please complete the evaluation. You will be prompted to register or sign in to complete the evaluation. You can register as a visitor at no cost. For CEs to be reported to CE Broker for Florida licensed healthcare practitioners, you must provide an accurate Florida Department of Health license prefix and number the first time you register. After you register or sign in, you'll be directed onward to the evaluation. You may consider using the same email address when you registered for webinars through our WebEx link and when you set up your profile in FADA's system. This helps connect your attendance and your profile. You will get a second opportunity to complete the evaluation through a follow-up email later today. The sender will be Messenger at WebEx. The evaluation will close at midnight on May 1st. We do not email statements of credit. Instead, after we verify attendance and completion of the evaluation, a statement of credit will be generated as a journal entry within your profile. Thank you for participating in today's webinar. We'd also like to recognize and thank especially the Florida Department of Children and Families, Office of Substance Abuse and Mental Health for funding today's education. Have a great rest of your day, and please hold for the evaluation.